وبركاته. إياك نعبد وإياك نستعين. आज का जो टॉपिक है वो मिलेनियम डेवलपमेंट गोल्स है, MDGs। अब जो है इसका पहला ये है वाई मीन टू accelerate progress on under 5 mortality rate, maternal maternal mortality rate, child malnutrition, income and poverty, primary education. MDGs and human rights. The Millennium Development Goals strongly emphasize the role of human rights and the value of freedom, solidarity, justice, and shared responsibility. Seven areas addressed in MDGs: peace, security, and disarmament, development and poverty eradication, human rights, democracy, and good governance, protecting the vulnerable, meeting the special needs of countries, strengthening the United Nations. What are the MDGs? MDGs were set by government leaders at the United Nations Millennium Summit September 2000s. All UN organizations decided to be guided by MDGs in their future actions, unity of purpose, coherent actions, synergies, and strategic approaches by the UN system as a whole. Leader apply to strive individually and collectively towards these goals through international, regional, and national actions concerted by the United Nations. Introduction. The Millennium Development Goals are eight international development goals that were officially established following the Millennium Summit of the United Nations in 2000. Following the adoption of the United Nations Millennium Declarations, all 189 United Nations member states that at least 23 international organizations have agreed to achieve these goals by the year 2015. Aims and objectives: to accelerate to encourage development by improving social and economic conditions in the world's poorest countries. Focus on three major areas: valorizing human capital, improving infrastructures, increasing social, economic, and political rights, with the majority of the focus going towards increasing basic standards of living. Objectives: the objectives within the human capital focus include improving nutrition, healthcare, including reducing levels of child mortality, HIV, AIDS, tuberculosis, and malaria, and increasing reproductive health and education. For the infrastructure's focus, objectives include increasing access to safe drinking water, energy, and modern informations, communications technology, amplifying farm outputs through sustainable practice, improving transportations, infrastructures, and preserving the environment. Lastly, for the social, economic, and political rights focus, the objectives include empowering women, reducing violence, increasing political voice, ensuring equal access to public services, and increasing security of property rights. The eight Millennium Development Goals: eradicate extreme poverty and hunger, achieve universal primary education, promote gender equity and empower women, reduce child mortality, improve maternal health, combat HIV/AIDS, malaria and other diseases, ensure environmental sustainability, develop a goal partnership for development. Millennium Development Goals eradicate extreme poverty and hunger. Goal 1 eradicate extreme hunger and poverty. Target 1 half between 1990 and 2015 the proportions of people whose income is less than $1 a day. The proportions of populations below $1 1993 PPP per day World Bank. Poverty gap ratio incidence multiply depth of poverty World Bank. Here are poorest quintile in national consumptions World Bank. Target to half between 1990 and 2015 the proportions of people who suffer from hunger. Indicator prevalence of underweight children under 5 years of age UNICEF WHO. The proportions of populations below minimum level of dietary energy consumptions. Millennium Development Goals achieve universal primary education. Goal 2 achieve universal primary education. Target 3 ensure that by 2015 children everywhere, boys and girls alike, will be able to complete a full course of primary schooling. Indicator 6 net enrollment ratio in primary education UNESCO. Proportions of pupils starting grade 1 who reach grade 5 UNESCO. Literacy rate of 15 to 24 years old UNESCO. Millennium Development Goals promote gender equity and empower women. Goal 3 promote gender equity and empower women. Target 4 eliminate gender disparity in primary and secondary education, preferably by 2005, and in all levels of education no later than 2015. Indicator 9 ratio of girls to boys in primary, secondary, and tertiary educations UNESCO. Ratio of literate women to men 15 to 24 years old UNESCO. Share of women in wage employment in the non-agriculture sectors ILO. Proportions of seats held by women in national parliaments IPU PU. Millennium Development Goals reduce child mortality. Goal 4 reduce child mortality. Target 5 reduce by two-thirds between 1990 and 2015. The under 5 mortality rate. Indicator 30 under 5 mortality rate UNICEF WHO. Infant mortality rate UNICEF WHO. Proportions of 1 years old children immunized against measles UNICEF WHO. Millennium Development Goals improve maternal health. Goal 5 improve maternal health. Target 6 reduce by 3 quarters between 1990 and 2015. The maternal mortality rate indicators 16. The maternal mortality ratio UNICEF WHO. The proportions of birth attended by skilled health personnel UNICEF WHO. Millennium Development Goal 6 combat HIV, AIDS, malaria, and other diseases. Goal 6 target 5 7 have halted by 2015 and begun to reverse the spread of HIV AIDS. HIV prevalence among pregnant women aged 15 to 24 years UNAIDS, WHO, UNICEF. Condom use rate of the contraceptive prevalence rate, UN, populations division. Condom use at lost high risk sex, UNICEF, WHO. Contraceptive prevalence rate, UN, populations divisions. Percentage of population aged 15 to 24 years with comprehensive correct knowledge of HIV/AIDS, UNICEF, WHO. Target date have halted by 2015 and begun to reverse the incidence of malaria and other major diseases. Indicators 21 prevalence and death rates associated with malaria. Proportions of population in malaria risk areas using effective malaria pre- preventions and treatment measures, UNICEF, WHO. Prevalence and death rates associated with tuberculosis. Proportions of tuberculosis cases detected and cured under DOTS internationally recommended TB control strategy, WHO. Millennium Development Goals ensure environmental sustainability. Goal 7 ensure environmental sustainability. Target 9 integrate the principles of sustainable development into country policies and programs and reverse the loss of environmental resources. Indicator 25 proportions of land area covered by forest, FAO. Ratio of area protected to maintain biological diversity to surface area, UNEF, WCMC. Energy use, kg oil equivalent per 1 GDP, PPP, IEE, World Bank. Carbon dioxide emissions per capita, UNFCCC, UNSD, and consumptions of ozone depleting CFCs, ODP instance, ozone sectorate. Proportions of populations using solid fuels, WHO. Target 10, halves by 2015 the proportions of people without sustainable access to safe water, drinking water, and basic sanitations. Indicator 30 proportions of populations with sustainable access to an improved water source, urban and rural, UNICEF. Proportions of population with access to improved sanitations, urban and rural, have achieved by 2000 a significant improvement in the lives of at least 1100 slum dwellers. Thank you very much. मैं यहाँ ही ख़त्म करता हूँ अब